Sir, good afternoon. Welcome.
Good afternoon, thank you.
Dr. Alpesh बात कर रहे हैं.
Dr. Alpesh, thank you.
Thank you. Thank you for sparing time and joining, sir.
No, it's my pleasure, don't worry.
Good afternoon, Dr. Harsh Vardhan. Dr. Harsh Vardhan, good afternoon.
Good afternoon, namaskar. Dr. Alpesh, namaste.
Good afternoon, sir. Namaste, Dr. Shanta Kumari here.
Doctor sir, namaste, namaste.
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 Thank you for sparing your time for Foxy and us.
No, it's a pleasure for me also.
You are very busy these days.
I think we are very happy that Modi ji has taken the decision of that Chinese app.
Ji.
That is very good thing.
Sir, once more, I think the time is right for us to start all the raw material of bulk drugs to be manufactured in India.
Yes.
All the pharma should be told to buy all the raw materials only from India. You should encourage that now, sir. All the APIs.
Ji.
We should only export. We should not import.
Sir, we are going to start inauguration within 2-3 minutes.
Yes, start.
Yes, sir.
We were all together, we were eating food, we were having coffee. Meera ji was just remembering कि एक cup coffee तो हो जाती सबके साथ. How times have changed.
कोई बात नहीं, फिर हो जाएगा, चिंता की कोई बात नहीं.
फिर चालू करेंगे. Yes, sir. Yes, sir.
Positivity.
Sir, we can start in next 30 seconds. The session gets over. We can start, please.
Welcome everyone. Before we proceed for the inauguration, may I request our office bearers to join us. Our President Dr. Alpesh Gandhi, incoming President Dr. Shanta Kumari Ma'am, immediate past President Dr. Nandita Balshekar Ma'am, our 5 Vice Presidents Dr. Atul Ganatra, Dr. Archana Basar, Dr. Anita Singh, Dr. Ramani Devi and Dr. Ramani Abdullah, our Secretary General Dr. Jaideep Tang, Deputy Secretary General Dr. Madhuri Patel, our Treasurer Dr. Suvarna, our Joint Treasurer Dr. Parikshit Tang, Thank you so much for joining us today. Let's herald this program in a traditional way of divine invocation through lamp lighting. Thank you so much. Our very dynamic President, Dr. Alpesh Gandhi, sir, to join us and share with us his vision for Foxy.
So thank you very much, Dr. Apurva, for the kind introduction. On behalf of Foxy, I extend warm welcome to Dr. Harsh Vardhan ji, Honorable Minister, Health and Family Welfare, Government of India, Dr. Rajan Sharma, President IMA, the guest of honor, all the faculties, chairpersons and the viewers. Foxy has decided to celebrate Doctors' Day for a special purpose, organ donation pledge drive. Before about the Foxy's vision, I would like to inform all of you briefly about the Foxy. Foxy is the Federation of Obstetric and Gynecological Societies of India with 260 affiliated member societies and over 38,000 practicing gynecologists as its members. It is one of the largest membership-based organizations of specialized professionals across the world. It established in January 1950. Foxy's primary mission is to decrease MMR and NMR, and it works for upliftment of women's healthcare in India. Before that, I also would like to mention about few things. The COVID-19 pandemic is upon us as one of the biggest health crises of the century. It brings with it uncertainty. The government is trying its best to prevent the spread by making policy guidelines and improving infrastructure in India. We at Foxy also immediately foresee in the middle of the March that it will be inevitable that we will be caring for pregnant women infected with COVID-19 within the next few weeks. We also foresee that it's a long fight. I would like to mention few things to our honorable health minister, sir, that what we had taken actions for in last 2 months or 3 months. We immediately published the short-term advisory for our members to guide them about the practice. We released our first short-term advisory on 17th March to continue the essential medical services in the pandemic, because we were knowing during lockdown these services are going to be hampered. And we also published the second short-term advisory on 27th March. Immediately MCI has done amendment for the telemedicine use in our practice. We were also invited by our Honorable Prime Minister for video conference meeting on 24th March. It was a proud moment for Foxy that our Prime Minister has invited us and heard Foxy's suggestions. Sir, we want to inform you that we presented 5 humble suggestions, and out of them 4 suggestions are implemented gradually by Government of India. We are thankful to our Prime Minister and Health Minister. We immediately published 2 GCPR in the short time of 9 days to guide and help our members in managing COVID-19 patients. First GCR was published on 26th March on perinatal management, and second GCPR was published on pregnancy with COVID-19 on 28th March. Our GCPR has been well appreciated by WHO, UNICEF, SAFO, medical colleges and our members with many positive feedback. It has helped lots of gynecologists and their patients. We also have immediately sent our guidelines to Government of India for its kind knowledge and approval, and we expect that it will be approved from Government of India. Sir, very important point what we have done is about the registry. We are the pioneer in India, not only in India, in the southern Eastern Asian countries to start national registry on pregnancy with COVID-19 infection. We are receiving very good positive feedback from many colleges, institutes across India. Many international organizations have shown interest to work with Foxy for this registry, and they want our help for the world registry. ICM Foxy's registry will bring many good observational studies and data which will be helpful to all the countries of the world to manage pregnant women with COVID-19, and it will be a great service to the women across the world. We request you, sir, our Honorable Minister of Health, Dr. Harsh Vardhan ji, to inform, if possible, to all the medical colleges to provide data to Foxy's registry. If we get the support from Government of India, we can bring India to new heights in the world. We can lead the world for the management of pregnancy with COVID-19. Sir, I would like to bring to your kind notice that across the world, pregnancy with COVID-19 means cesarean section. The rate of cesarean section is more than 90% when patient is infected with COVID-19, whereas in India it is between 50 to 60%. So we can bring this to the countries across the world, and we can change the management. We can help the pregnant women across the world. We need data, and if we get support from government and medical colleges, we will definitely take lead in the world. Foxy has decided to celebrate Doctors' Day for noble humanitarian cause. This 1st of July, today, Doctors' Day, Foxy is launching a nationwide campaign for the awareness and sensitization of organ donation and organ donation pledge drive. We are thankful to our Honorable Minister, Dr. Harsh Vardhan ji of Health and Family Welfare, Government of India, for kindly accepting our invitation to inaugurate the e-conclave as the chief guest. Sir, it is a great motivation for all of us. We know that you are very busy because of this COVID-19 pandemic, but even though you have spared some time for us, it is a great motivation for all of us. We are thankful to Dr. Rajan Sharma, President IMA, for kindly supporting the cause and joining as the guest of honor. We are also thankful to Ritesh Deshmukh and Gynae for joining with us to boost up our morale. We have been we have seen the agonizing wait for suitable donors by the patients and relatives suffering from liver failure, renal failure, and other organ failures. We know that 5 lakh patients die in India per year waiting for transplant. 2 lakh people die of liver disease, 2 lakh people await a kidney transplant, and 50,000 people die from heart disease. Only 350 to 50 heart transplants are conducted. 10 lakhs people suffers from corneal blindness and await transplant. Corneal blindness is one of the most important causes of blindness in India, and this can be treated by corneal transplantation. These are the data of 2017, and we can see the huge demand-supply gap in India. I will not go in detail of it, but we know that it is a Fox's vision that life is the precious gift God has given to us. Our body is a biochemical unit which has the unique functions of heart, liver, kidneys, and eyes, which are utilizable even after death in the form of organ transplant. One donor can save up to 8 lives by organ donation and heal up to 70 through tissue donations. And there are many myths associated with organ donation, but it is not true. We appeal all the citizens of India for let us pledge for organ donation and let the nearby family members and friends know our noble intention and let them be inspired to join this cause. We have made an online easy manner to enable people even in current adversities without having to go out to take the pledge. Let us pledge in large number to donate our organs after the death. Let us together make this world a livable and a lovable place. Let us live after death. So many doctors and healthcare providers lost their lives while serving as corona warriors. It's great loss to families, societies, and our country. We pay tribute and we salute to all of them. Being a doctor is a great responsibility, and during this COVID-19 times, all the doctors are doing amazing services to mankind. Only a doctor is blessed with the ability to treat a disease and to bring good health to human lives. On the occasion of Doctors' Day, let us decide to work further to improve community health in our country. I wish you all safety and a very happy Doctors' Day. Please take care of yourself. And today also we are going to launch indemnity insurance scheme for our members with 50 special benefits and 80% of the discount in premium. So thank you very much, friend. And I wish all of you a happy Doctors' Day. Please take care, and I wish safety to all of you. With this, I hand over mic to Dr. Apurva.
As Hippocrates said, extraordinary times require extraordinary measures. In this extraordinary times, our President, Dr. Alpesh Gandhi, and his team has taken this extraordinary drive for organ donation amongst the entire OBGYN fraternity. Thank you for sharing your vision, sir. Your vision is our mission. It gives us immense pleasure also to have Dr. Rajan Sharma, the guest of honor for today's program with us. I invite Dr. Jaideep Tain, sir, the Secretary General of FOXI, to kindly introduce him and invite him to the platform.
Thank you very much, Priyankar. It is indeed a pleasure and privilege to introduce the current IMA President, the well-known orthopedician from Yamunanagar, Haryana. Professionally, he runs and manages the Rajan Hospital and the Dr. J.P. Sharma Memorial College of Nursing. He has several international publications, is a Paul Harris Rotarian, and was the Rotary Medical Mission Director to Rwanda, Gabon, Cameroon, Zimbabwe, etc. Dr. Sharma has been active in the IMA for several decades, starting as a CWC member and then president of the IMA Jagadhiri Yamunanagar branch and then Haryana State branch from 2011 to 2013. He is the coordinator of the Beti Bachao program of North Zone. He successfully led the Haryana State branch, and due to his active involvement, hospitals with less than 50 beds in Haryana are exempted from the Clinical Establishment Act, the only state where this has happened. And Haryana is one of the few states where a district medical negligence board has been constituted. And Haryana was the third state where the Act for Violence Against Doctors came into existence. We are very happy to have him here with us and look forward to hearing his thoughts. Dr. Rajan Sharma, please.
May I request Dr. Meera Agrihotri ma'am to come over and introduce our guest of honor, Honorable Chief Health Minister Dr. Harsh Vardhan ji.
At the outset, on behalf of FOXI, I extend my heartfelt gratitude to Dr. Harsh Vardhan, Honorable Union Minister of Health and Family Welfare, for being with us as chief guest to inaugurate Doctors' Day Summit for the most noble cause of humanity. Dr. Harsh Vardhan doesn't need any introduction to this august gathering. He is day in, day out with us in war against Corona. Yet, since it is ritual and customary, I do it. Dr. Harsh Vardhan is a guiding star of World Health Organization today, pride of our nation and honor of medical fraternity. He is the brightest jewel, the gem, GSBM Medical College alumni given to the country. He has started his professional journey as a humble, meritorious medical student up to the noted ENT surgeon, otolaryngologist. He is the member of the Rashtriya Swayamsevak Sangh since his childhood. He decided for a U-turn after his professional career to translate his professional services into public service. Thereafter, he never looked back. He served the government in different capacities and portraits till he reached up to the highest chair of the health as custodian of the National Health, Union Minister of Health and Family Welfare. Now this is not the first time. He is there for 2 times, not once. Firstly, with the late Honorable Prime Minister, Bharat Ratna Sri Atal Bihari Vajpayee, who felicitated and titled him as Harsh Vardhan instead of Harsh Vardhan. Presently, he is in the cabinet of our most adorable Honorable Prime Minister Shri Narendra Modi ji. This itself speaks volumes about the hard work, dedication, perseverance and passion of extending health services to ailing humanity. He is known for his honest and strict view in the implementation of the national health policies and yojnas. One of the highest honor bestowed to our nation reads Dr. Harsh Vardhan, Union Minister of Health and Family Welfare. He was elected chairman of WHO Executive Board. WHO provides leadership to the entire world in the field of public health and related issues. He has taken oath and charge as chairman on 22nd May 2020, only a couple of weeks back. In the crown of the country, it's a red feather in the crown of Dr. Harsh Vardhan. Dr. Vardhan is a pioneer of the most successful pulse polio program, which was launched nationwide in 1995. He received WHO honor and India was declared polio-free by WHO in 1914. He has been in the forefront in fight against tobacco. The first anti-tobacco law implemented by any state government was the result of his effort. He was a state Minister of Health in 1994-95, thereafter as an Education Minister. Will you believe that the sale of the tobacco was a crime in those days and now it is state practice? The Regional Director for WHO, Southeast Asia, addressed Dr. Vardhan as best captain at the steering wheel in the Corona eclipse and pandemic. He is chief of the army of the warriors in the war against Corona. It is partly won, as mentioned by our Honorable Prime Minister yesterday evening. His passion for women's health and family welfare, for women empowerment, is well known to all of us, the Foxians. In 2018, as chairperson of the International WWCon conference, first ever any conference blessed by the President of India, as a chief guest by our Honorable President and Dr. Harsh Vardhan as guest of honor, who came to us in the same aircraft in the President, that shows his passion for the women's health. Wherever there is an issue of women's health, it was discussed with length, breadth and depth, and there are these are the testimonials of his commitment to Foxy. He is the recipient of innumerable national and international awards in the field of the health and public service. In the last but not the least, I am his proud teacher. We wish to see Dr. Vardhan on the page of medical history in golden words, on the footsteps of Dr. B.C. Roy, a doctor turned politician, wishing vertical progress where sky is the limit. Thank you very much for the kind listening. Here are certain photographs which I can mention. This is 2004, where Dr. Harsh Vardhan was with Dr. Sushma Swaraj, who was with us as chief guest. I happened to be the guest of honor, and here, even when he was not in the cabinet, he has discussed the problems of the health at length since morning till evening, wherever Dr. Sushma ji was there. Sushma ji used to like him as a very important part of the BJP government. These are the inaugural ceremony photographs of women health and wellness for women empowerment, where President of India was there for our Foxy. These are the inaugural Dr. Jaydeep and all the VP seen over there. This is 2019, where we had a Arogya Mahila Summit for the women health and women empowerment. All the past presidents and present presidents are present over there for our Beti Bachao, Beti Padhao Abhiyan. I hand over the mic to the secretary. I extend my heartfelt wishes to Dr. Harsh Vardhan, and I want to see him at the highest chair wherever it is possible. Our Foxy salutes him for his endeavor to the Foxy. Thank you very much.
You want me to start?
Yes, sir.
Dr.
Okay.
Harsh Vardhan to kindly start the oration.
Okay. Thank you, sir. Thank you.
The Foxians are waiting for your words of wisdom.
Oh no, thank you
We
so
are all
much.
waiting for your words of wisdom.
Thank you, Dr. Meera Agnihotri. You happen to be my teacher also in my alma mater, and your kind words give me a lot of inspiration and blessings. Thank you for all the kind words. I really don't know if I really deserve all of them. But anyway, thanks once again, Foxy, for giving me this privilege of being with you on a very, very important and pious occasion. President of Foxy, Dr. Alpesh Gandhi, Dr. Atul Ganatra, Dr. Jaydeep Tank, past presidents Dr. Nandita Patshelkar, whom I could see on the screen. There are many others. In fact, I'm sorry I may not be able to name everybody, but my regards and good wishes to all of you, all the members of Foxy, all the past presidents, all the senior people. I don't know whether Dr. Rajan Sharma is connected to us or not right now, but in any case, my good wishes to him also, our president of IMA. I am so happy to be with you on this particular day. We all know that today is National Doctors Day, and this National Doctors Day was created just to pay the most humble tributes of the nation to the memory of the great Dr. B.C. Roy. In fact, it is a tribute to the doctors, but this was named because we had a leader like Dr. B.C. Roy, who was born on 1st July and whom we lost also on 1st July. Honestly, he has been one of the greatest icons for the medical profession, who has dedicated his life very selflessly, not only for the cause of the medical profession or the patients, but also for the nation as a great educationist, as a great political leader, as a great freedom fighter. And in fact, just before this program, I was part of another program where we launched a fellowship program for international doctors of the region through the National Board of Examinations. And I was, in fact, this is a program where foreign doctors will apply for Indian fellowship, and it was a historic moment. And I was trying to recall that when our great Dr. B.C. Roy had applied for a fellowship in England at the St. Bartholomew's Hospital, his application was rejected because he was an Asian. And then it is history that he kept on applying, and every time his application was rejected. And after 30 rejections, the dean of the St. Bartholomew's Hospital in UK ultimately had to accept his application. And he is one doctor who within 2 years and 3 months got not only the MRCP but also simultaneously got the FRCS also. So he was a member of the Royal College of Physicians also, and a fellow of the Royal College of Surgeons also. So it's a very, very great moment for us, and I think the most important for all of us is to remember our great leader, our Bharat Ratna Dr. Bidhan Chand Roy today, who did so much for the medical profession. His role as the President of the Medical Council of India before independence, and as the President of the Indian Medical Association, also as Chief Minister of West Bengal for over a decade, and as a freedom fighter, and as one of the bright meritorious students. I think there are so many great things about Dr. B.C. Roy which all doctors must know and must remember, and I would start by paying my greatest tributes to the memory of Dr. B.C. Roy, and would love to congratulate all of you and then wish you all the best on this National Doctors' Day. Our Prime Minister has, I think, expressed the greatest feelings of our government for the doctors on 22nd March, when he had appealed to everybody to, on record, pay the tributes of the nation. And it was 1.35 billion people who came out of their house on the Prime Minister's appeal. Barring any, ideologies or anything, everybody came out. And for the last 4-5 months, everybody in the country and all across the world has literally been acknowledging and worshipping the doctors, acknowledging the contribution of the doctors as corona warriors. And we also feel sad that we have lost many of our doctor friends in this fight against COVID. We have lost many of our nurses, paramedics, and very, very important senior doctors we have lost in this particular. So this is an unusual time for all of us, unusual situation. But the great thing is that I have not seen even one single doctor till now who has either lost confidence or whose morale is low. And I would also like to pay my tributes to the mothers of the doctors who have not stopped them from going to work. And every doctor is, in spite of whether he is a junior resident or a senior professional, they are in close contact with the COVID patients. They are not shirking from their responsibility. They are doing their best. And this is why, because of the great contribution of our doctors, we can find that India is, I think, far better in its performance as compared to the rest of the world, with the least mortality rate in the whole world and the almost maximum recovery rate in the whole world, and with the least cases per lakh or least deaths per lakh as compared to any other country in the whole world. I think we, because of the contribution of the medical community, have done so well. So the contribution of the medical fraternity during these COVID times, it will always be remembered. I think it will go down in history. People used to say that the doctor in the society is some sort of a substitute of God, but probably is for the first time that people have also, although there are a lot of stigma issues which probably we have been able to overcome by now to quite a great extent, but now people have started really appreciating when they see that so many doctors have also lost their lives. So now they have started appreciating the contribution of the medical community. And I know that you as Foxy, because your work is something which doesn't stop with anything, because I know that other diseases somebody can ask people to wait, but if there is a pregnant mother and the delivery is due, whether it is COVID or no COVID, the gynecologist has to handle the patient. She has to go to the labor room, she has to conduct the delivery, she has to ensure the safety of the mother, she has to ensure the safety of the child with the help of the pediatrician. So I know that as Foxy, you have also contributed a lot during these troubled times, ensuring that the maternal services and related activities do not stop anywhere, whether in the government sector or in the private sector. And we have been able to ensure that during these COVID times, while the great amount of concentration of the government and the health care delivery system is on COVID patients, but our non-COVID activities do not suffer. I was happy to see from the slide presentation that a lot of guidelines have been contributed by you, and you have also given good quality guidelines to your over 38,000 members. And I am sure that because this being a new disease and its new behavior, and even now we can't say for sure 100% about the behavior of the virus. So under these circumstances, any guideline from any responsible organization for its members, I know it must be a great welcome move and must have been received well, because in health ministry we know that there is hardly a day when we don't have to draft a new guideline for a new subject with the help of experts, and there are, I think, hundreds of guidelines that we had sent to the country all across India during this period. And you will be happy to know that we were the first country to respond to the news of the COVID virus, which was informed to the whole world by China on 7th of January. And on 8th of January, in this ministry itself, where I am sitting right now in Nirman Bhavan, we had called our first meeting of group of experts. And in the next 7-8 days, we had drafted the detailed advisories for all our states, governments, and all related health professionals, and delivered them those guidelines, and then also ensured that we have detailed community surveillance activities. We had point of entry surveillance, and then so many things that happened during the course of the last 4 months. Prime Minister had constituted a group of experts under me. We met 17 times. We had ministers and all senior bureaucrats in that. The Prime Minister had been monitoring himself. You have seen the various phases of the lockdown. You have now seen the various phases of the unlock period also, and during these period there had been so difficult times, issues of migrant laborers and so many things, but the government tried to handle all of them with the help of the medical community and the related systems. Today we have been able to create almost 13 lakh beds dedicated to COVID care in our COVID hospitals and COVID health centers and COVID care centers, and it's almost for everything that is needed. A lot of activities have been happening. There are a lot of activities which are happening on the scientific front. Since I handle the science ministries also, so there's almost a dozen candidates in India working on vaccine. Our CSIR and other scientists are working on discovery of new drugs or repurposing of the old drugs for COVID. Simultaneous research going on for scientific modern techniques being used for research in the drugs available with the Indian systems of medicine. So there are so many activities which are going on, and I am sure with the consistent support being provided by our medical community, our organizations like yours, and now I can see Dr. Rajan Sharma also there, the organizations like Indian Medical Association, everybody has been putting their heart and soul. Every professional is supporting in some way or the other. So it's very heartening, although we feel sorry for those lives that have been lost, and it's not only the patients but our own doctors also who have lost their lives. But I'm so happy that you have dedicated this particular day to organ donation movement, and incidentally this particular subject has been so close to my heart, and I have worked on it very passionately for last 25 years. When I was health minister in Delhi 25 years back, we started the first total body donation movement, which, because there used to be a lot of shortage of cadavers in medical colleges, and for the cadaver organs that you get from cadavers and all. And now over the years this movement has grown so big. We got the NATO also officially organized during these years. We have all seen the Organ Transplantation Act, which started its journey in 1994, and then it got amended also. But still I feel that as compared to countries like Spain or UK or Australia, our number of the organs that are donated in India is, I think, quite less. It is just about 0.65 per million as compared to almost 35.1 in Spain. I had myself gone and visited and seen the organ donation program of Spain in 2014 when I was Union Health Minister. So there is a lot that needs to be done, although there is a lot of awareness already there. In recent past, we organized two big functions in Delhi where we called both the sites, means those who had donated the organs after brainstem death and all of their family members, and those who had received. So it was such an emotional scene where people who had received, they would speak something, and then the family members of those who have already lost their family member, but they feel that the organs of those family members, they are still, their heart is vibrating in somebody else's body, or a lung, or a liver, or a kidney, or a pancreas. And I think after brainstem death you can use almost 37 organs. So this is a, but this in India what I have felt is that India has that inherent goodness and inherent feeling where everybody wants and loves to do some good things which help humanities. And if that feeling, if we can ensure that that feeling is we can ensure that we keep that feeling alive, we motivate people to do good things, then people accept the good things. And if those good things are conveyed, I think by doctors, and amongst the doctors I know the gynecologists have a contact with the key person in the family, the spirit or the backbone or the real, you can say the pivot of the family is the mother. And mother is one person who is we always say that God has to be omnipresent, and to keep himself omnipresent he created mother, so that there is God in every home. And the contact with this mother God is only with the gynecologist. And if we can convince that God in the family, then all those things that we want to do, the good things for the society, I think there can be a huge dissemination of positive energy for that. And I'm sure that once Foxy with its 38,000 membership takes up the cause of organ donation, where it is being now supported by law also, it is being supported by so many well-meaning NGOs all over the country, and the official systems are also contributing by creation of green corridors and so many things. And there is a very positive feeling for this particular movement in the society. Certainly it is the need of the hour. You have yourself shown in your slide how many people they die, lakhs of people they die because of want of organs. And it is not that we don't have the organs. We have the organs, we have the people. Almost 80,000 people die in road accidents. So many means statistics tell us that if we pursue the course of organ donation in the right direction, with the right perspective, with the right spirit and the right type of organization, there is no doubt that we can achieve great success. So I would love to congratulate all of you once again, and wish you, and once again I would repeat that as far as your department is concerned, I started with my Matri Suraksha Abhiyan 25 years back when Dr. Kamal Bakshi used to be your president. And now, even now as Union Health Minister, the mandate that I have given to my people here is that I don't want even one maternal mortality. Why should a mother die just because she became pregnant? It can't, it has to be a boon for every mother. It can't be a, like she should always feel blessed. It can't be a curse for her. And that is the spirit with which we would like, because the programs we have modified here, they will need the cooperation of every gynecologist, and we would like that at every stage, whatever the loopholes are there in the system, we would like to repair all those loopholes, plug all of them, and see that unless there are unavoidable causes, we know that there could be few, But otherwise, there should not be a single maternal mortality. There should not be a single woman in the country with anemia. Why should there be anemia prevalence in the country, and more particularly in pregnant women? And I think this is the time for the FOXY also to start working on, because I don't except for, I got one paper by one gynecologist, I am forgetting the name of that gynecologist, who had done a uterus transplant. So this movement, it has not become very strong in India right now, but I think although that may not be a life-saving thing, but for those who need a uterus for a baby, and for them uterus transplant, and for others to donate uterus also. So that movement also has to grow in India, and I would say that at academic level, the FOXY must support such gynecologists, and from the government side, we are all with all of you for the you can say for taking this particular aspect also forward. I know that there have been some successful uterus transplants in some countries in the last 5-6 years, but India, I think, needs to grow in this particular field also. We are already doing so many transplants of other organs, but uterus also needs and deserves a little more attention, and I'm sure the FOXY people with senior people like you will certainly plan something in that direction also. So with these few words, I once again thank you all for giving me this privilege. Once again, all my good wishes to all of you on the Doctor's Day. A great happy Doctor's Day to all of you, all our Corona warriors, and I wish and pray that all of you keep yourself healthy and protect yourself from Corona during these Corona times. Dr. B.C. Roy also said that you cannot dream of a Swaraj unless we have a strong and healthy body and mind in the society, and I think that's what we all have to contribute to. So thank you so much. Namaskar. Bharat Mata ki Jai.
Thank you, Dr. Harsh Vardhan, for being ever supportive to FOXY, for being an inspiration for us and leading us by example. To join you in this endeavor and serving our nation, our President, Dr. Alpesh Gandhi, and his team have started this wonderful initiative of organ donation drive. Although we've had a mammoth response to this drive, we noticed that even the most learned people had some hesitation towards this noble cause, and thus came this idea of organ donation conclave. We truly hope that we will bring a positive change of mind for many people. May I request our President, Dr. Alpesh Gandhi, sir, to say a few words on the occasion?
Blessings. Thank you very much for sparing your valuable time in this difficult time. We know that how much it is important, and your message will definitely bring impact. It inspires all of us a lot. It motivated us, encouraged us. We are thankful that you appreciated gynecologist services in this difficult time of COVID-19. Yes, we all are continuing our essential maternity health services, family planning services, abortion services. Though it was very difficult, but we continued our services, and thank you very much for appreciating our services. Thank you very much for appreciating our efforts to bring out guidelines from 15th of March to 29th March. Only in 2 weeks we came out with the 2 guidelines with frequently asked questions, with registry, with short advisory, and we were very prompt and proactive. We know Government of India is also very prompt and proactive, and we appreciate your prompt actions. Because of your actions today, we can say, yes, proudly we can say that we are able to control the spread of COVID-19 compared to rest of the world and developed world, and our recovery rate is significantly high than the other countries. Yes, and at the same time, yes, your message will be very much taken regarding the anemia and uterine transplant. We would definitely work. We have so many projects, and the theme for this year of FOXY is safety first. Safety first means for safety for all, including patients, Indian women and fetus and tiny patient fetus, neonates and doctors all are included in this safety first. We would work definitely on all these aspects. And I would like to inform you, sir, that this is just today we launched the organ donation pledge drive. It will going to continue throughout the year, and today only we have more than thousands of people who took the pledge, and definitely we pay great tribute to the great service done by Bharat Ratna Dr. B.C. Roy. Thank you very much, sir, for the message, and we are there with you for all the government's endeavors to combat the pandemic. We are one unit and we are with you always, and we also believe that you will be with us for all our problems. And if we can pregnancy with COVID-19 may be the one aspect where we can lead the world, because we believe that in rest of the world, in developed world, incident pregnancy is not so common like in India, and if we can have a good data, then probably we can lead the world. So we'll definitely also like to take your support for this endeavor, and thank you very much, sir, once again for your message and blessings. Thank you.
Dr. Harsh Vardhan, we would like to take the pledge for organ donation. If you will just support us, all the office bearers requested to raise their hand, and we will take the pledge for organ donation in front of Dr. Harsh Vardhan. We office bearers of Foxy.
We office bearers of Foxy
pledge to donate our organs.
Pledge to donate
our organs.
Thank you, sir. Thank you very much.